So you want to do this when you're both calm. So before you do it, try and relax and remember it's just a try, and if it doesn't work, it's okay. So then you'll take your baby and put his head on the left side. Actually, I'm going to back up a little. So before you do it, before you feed him, have Angel hold the baby or something. You want to take off your shirt, take off your bra, and you're going to undress the baby down to his diaper. Okay, so let's go ahead and get our baby. I'm not going to get undressed, but don't worry. But we're going to have our baby kind of naked baby. And then you'll have like a blanket or something you can put around your shoulders and put around him to keep you both warm. The next thing you want to do is, and probably you'll want to do this first so he's not getting cold, but you're going to want to express a little bit of milk so that it does two things. One, it starts getting that milk flow, and you can have what's called a letdown, which is when the milk that's stored up in the upper tissue of your breast is allowed to come down to the nipple. So there's a chemical called oxytocin, I'm sure you know this. It's released in your brain, and it causes some kind of like, you can imagine like doors to open and let the milk down. That's why it's called a letdown. Anyway, so if you express a little bit of milk first, then it's going to help to go ahead and start a letdown. It's also going to make your nipple smell like yummy milk, and the baby's going to be more likely to want to open his mouth and latch on. The other thing is you can massage your nipple a little bit just to kind of elongate it. Once baby starts sucking, it kind of pulls out a little, elongates. But if you do that first, there's two things that'll happen. One, it will help make your nipple not quite so sensitive so it doesn't hurt quite as much. So that's good. And the other thing is that it pulls the nipple out a little bit so you can get a deeper latch and the nipple gets further back in the baby's mouth. And I'm going to talk a little bit about why that's important in a different video. So you'll do that. And then when you go to latch the baby on, there's a couple of important things that you have to do. So one is you want to make the baby a sandwich so he can take a nice bite out of your breast. And I've heard a lot of lactation consultants say to do this in the wrong way. And I've seen a ton of videos that say to do it in the wrong way. And that's how I did it first. I did it the wrong way. And that's why I had so many problems. So many people tell you to hold the breast in a C. If the baby is in this cross position, his mouth is going to be like this, going up and down like this. So when you create a C, you're making a really long sandwich for him to have to try and grab onto. Instead, you want to make him a nice sandwich that's like this to match his mouth, and he can just bite in really easily. So if he's coming across your body like this, so you're using the cradle hold or the cross cradle hold, you want to make not a C, but a U. So you're going to have your hand all the way underneath your breast. I have really small breasts, sorry. And then you're going to squeeze in a U. So I don't know if you can see this. So you're just going to make a U. And you want to make it as tight as you can around your nipple. It's easier for me to do this on my right side. So you're going to make just a nice, tight U. That's going to be a nice little bite for the baby. Easier to get a lot of tissue back into his mouth. And you're going to have a lot more success that way. Okay. If you have the baby in what's called, I think it's called the football hold, this did not work with me. It's usually better for women who have bigger breasts. I don't have that. But the way you do that is you'd have the baby laying down like this, and then his head would come up like this. So his head is actually straight up and down like mine is. And so his mouth is coming across this way. In that case, you want to make a C so that his sandwich is perfect for him to bite into. But if he's coming across your body, you want a U. Make a U with your hands and squeeze until you get a nice tight sandwich like that so he can easily bite into it. Okay, so then once you've got your sandwich, and I forgot my prop. I'm going to use this. Okay, let's pretend that this is your boob and that's your nipple. This is a little light, but we're just going to pretend it's a boob right now. So if this is your nipple, the little tiny red thing, then you would tickle the baby's nose with your nipple from the baby's nose down the upper lip and all the way to the chin. And especially working on this upper lip. And that should cause him to kind of open up. And sometimes he'll open a little bit like, I'm not sure if I want this. But you want him to have a really nice wide one. So keep going until it's a nice wide and he's ready to take a lot of boob in his mouth. And then, so that's your left hand. You're doing all this with your left hand, assuming that the baby is on the left side for your left breast. So you've got your left hand on your breast making a U and a nice sandwich for him, and your right hand is going to be on the back of the baby's head. As soon as he gets that big, nice, open, wide mouth, instead of trying to go forward, this is a big common mistake, instead of trying to go forward to push the nipple into his mouth, you want to take his head with your right hand and push it back onto your nipple. He's just a lot easier to control than it is to try and like move your body and try and get your nipple in his mouth. So it's way easier if you just take his head and just shove it onto the nipple. You got to do it real fast because as soon as he feels something in his mouth, he's going to close. Or at least Bastian did. Most babies will. So if he feels that something going to his mouth, he's going to close. And if he closes before he gets very much of the breast tissue in his mouth, he's going to have a really shallow latch. You don't want that. So go ahead and as soon as he's open, let's say his mouth's open, you're just going to push him on really fast and really deep onto your nipple. The other thing is that you want your nipple to be angled up. So as you do that, where's my thing? As you're tickling his face with your nipple, you want the nipple to be kind of facing up to your nose so that when it goes into his mouth, it should go right along the roof of his mouth and back into his mouth to where the soft palate is. So again, you want it to be facing up towards his nose when you tickle him, and so that when his mouth is open and you push your breast in, it's going to angle up. And I forgot what I was going to say. I don't remember what I was going to say. Oh, I know. Okay. So you want to get as much breast tissue in his mouth, and you want to get as much of that areola, the darker area of the nipple, into his mouth. And it's more important that, from the nipple, he should have more below the nipple in his mouth. It's more important that you get that tissue that's below the nipple in his mouth than it is for a lot of tissue above. So you want, trying to think of how to explain this, you want mostly, the nipple and then everything below it in his mouth. As long as he's got a nice big latch, he's okay. And you can tell that based on how the angle of his mouth is once he's latched on. So, a nice wide angle like this is really good. But if he's got a smaller angle of his mouth, you can see this area. If it's small, then it's probably not a good enough latch. You want it really wide, like wider than you can even imagine, really big, nice, wide. They say it should be like a K, a big, wide K. So, every baby is different, so you're going to have to know and learn what's wide for him and what's not. And then you'll get to know, like, what looks right and when it doesn't look right. You want to make sure you get that wide latch every time. And you can know afterwards, after he's done nursing, you'll know if you had a good latch or not, because when you take your breast out, your nipple should not be crushed. It should not be squished. It should not be flat like a pancake, or it shouldn't look like a tube of lipstick that's kind of angled at the top. It should look like a nipple, like a normal nipple. If it's squished at all, it means it's not getting far enough back into his mouth. It means you're basically squishing the nipple between the hard palate and his tongue. Not a good place to be. So you want to try and get it farther back, and that just means that next time you're going to try and do a deeper latch. So as soon as he's latched on, there's a couple things that you want to check. And you can kind of do like a checklist. He's latched on. Okay, good. So the things we're going to check is that he's got that open mouth, like a big wide K, good, nice angle. The next thing the very, very first thing we want to do is you're going to take your finger and you're going to put it on his chin right here, and you're going to tug down just slightly. And you can see that when I do that, it pulls my lip out. It flares my bottom lip a little bit. You want the bottom lip to be flared. And even if it looks flared, do it anyway, because sometimes it's not as flared as it should be, but it still looks okay. But if you just go ahead and make a habit of tugging on that bottom on his chin, it'll flare open his lip a little bit, and try it and see what happens and see how it looks. So that should flare his bottom lip a little bit. And then the other thing it'll do is when you push down on his chin, you can see it causes my mouth to open just a little bit more, right? So if he has a shallow latch and a smaller angle, you can tug down on his chin, and hopefully he'll suck in a little bit more of the breast tissue and get the nipple farther back in his mouth. And the next thing you want to do is go around the top and just very gently do the same thing to the upper lip. Tug up the lip a little bit. If you can imagine, if your lips are like this skin here above your lips is a little bit rough. The skin on your lips is really smooth and it's moist. So if your breast tissue is pulling back and forth against your lips, it won't have any friction. It'll easily go in and out if it needs to. So if he needs a deeper latch, he can suck more breast in easily if it's on your lips. If it's not, it's too much friction. He can't pull any more breast in, which means he can't get a deeper latch. So he can correct his own latch, assuming that he's got a nice, smooth area of lip that he can pull more breast in if he needs to. But on the top lip, you have to be careful because you can break the suction if you pull too hard. So just gently go around. And you're going to do this every single time for at least the first few weeks, just until you both learn what's right and you kind of get into the hang of things. Every single time. Check the bottom lip, check the top lip. Okay? And then you want to check the baby's position. So imagine my hand is a breast. I know it doesn't look like a breast, but babies, I'm going to do it like this. So the baby's head should be like this. The chin should be pushed into the breast. Again, this will help encourage the chin to stay open. Okay? Nice and open and pushed into the breast. And the top of his head should be up, off the breast. So it should be an angle like this. Okay? Also, his chin should be off of his chest, out like this. It shouldn't be in like this. It should be out like this. So it should look something like this. That's my baby sucking movement. So instead, if you're doing it like this, you can try it yourself, and you can see that if your chin is up against your chest, it's going to close your mouth. It's hard to keep an open mouth if your chin's up against your chest. That means a shallower latch. That means your nipple is going to be in the hard palate, and that hurts. Not good. So if his chin is nice and off, it gives him the freedom to open his mouth bigger, suck in more tissue, move around a little bit more. He's got more freedom. And again, if your breast is against the bottom of his chin, if it's pressing against his chin at kind of an angle like this, that's perfect. The nose can actually be off of the breast. The nose of the baby is not the important area. And some lactation consultants will say, no, you want the breast all the way pushed up against his nose. Doesn't matter. It's the chin that's important. And if the nose is off the breast, it's fine. And if it's pressed into the breast, it's fine. I have small breasts, so his nose didn't even touch the breast. If you have bigger breasts, then probably his nose will touch the breast a little bit. The nose is an important area. It's the chin that's really important. So you want his chin pressed into the breast and off of his own chest. And that's your basics of breastfeeding. Those are my basic tips and tricks. And I'm going to do another video that talks about the anatomy of the mouth and why it's important to not have the baby's hard palate on your nipple. And the other thing I want to talk about is a little bit about hand expressing, to tell you exactly how to do that. I don't know if they showed you, but it's a really important tool to learn. And so I'm going to tell you how to do that. Okay. But that's all for this one.